Welcome back to the consult room. This is episode 4, and today we're diving into a topic that's often reduced to lab results and numbers, but is so much more than that: thyroid health. Whether you've been told your levels are normal or you're still searching for answers, this conversation is for you. Because thyroid health isn't just about a single test result. It's about how you feel, how your body functions, and the bigger picture of your overall well-being. So thank you for being here. Grab a healthy snack, pour yourself something to drink, get comfortable, and tune in. Let's take a deeper look at thyroid health beyond the numbers.
Yay! Good evening, everybody. Gabby and I are finally back. I had my mini break, and then I didn't really have a mini break. I had a regular break. You had a mini break. You had like a nap version of a break.
Sprint break. Yeah. Just 1 week. Not enough, but yeah.
No. Never enough. So, first of all, I had to bring my camel because it's hump day. We decorate clinics, so if you ever come in person, we have camels everywhere. So it is hump day.
I was seeing a video of that on your social media. That was super cute.
Yeah, we made that last week. So this week we made the decision, both due to occurrence in our life, because I had a new patient present with this complaint of, I know my thyroid's not right. I know my thyroid hasn't been right for years. Is it the chicken or the egg?
Right.
Both Dr. Gabby and I see this a ton in terms of gaslighting in conventional world being the cause for weight gain and sluggishness and hair loss and fatigue and anxiety and all of those things, right? So we figured we'd dive in. We'd talk a little bit about how we approach thyroid and what it looks like in our world, and then talk a little bit about things that lead into autoimmune stuff with the thyroid.
Right. So usually, we do know that, as you were saying, like, commonly I do see this as well in my practice, that I always have patients coming in with labs from another doctor or they're establishing care, and they're like, oh yeah, but my thyroid was okay. And I'm like, okay, so I need to look what exactly they did when you mean by thyroid. And I would have to say like 9 out of 10 times it's just that TSH and maybe a T4, and that counts as sufficient for checking your thyroid, when we do know, and based on even research and what we've learned doing and practicing the way we do, that is just one piece. Like, we need to do much more thorough evaluation on your thyroid. And one of the testing, not just your TSH and your free T4, we want to look into the other breakdowns for your thyroid, such as like your reverse T and your also circulating T3, because we do know that T4 converts into T3, and the T3 is your active thyroid hormone. So I've seen a lot of patients that when I even have done their T3 or in the reverse T3, their reverse T3 is actually much more higher than it's supposed to be. And I can kind of like say like, hi, there's something else going on here. And then also I see that their T3 is either low or low normal. And I'm like, no wonder you are like running on empty. And that once we kind of like address that, or even for some patients getting T3 in their as a thyroid supplementation or like as their medication, they do much better. And I know you clearly have seen that as well.
For sure. So my case today was somebody who came to me through another thyroid warrior who's seen me since I was in the conventional world. She has a compounded thyroid that she's been on for years, can't go back, can't see her primary and get it, sees me twice a year for, a quick med check. This warrior came in, she already had her labs because, cool thing, her conventional doctor allowed her to check her TSH. So conventional doctors will usually check TSH, but as Dr. Gabby said, it takes so long for our TSH to get to a point where it's 4 or 5, which is all they look at when we look at, conventional labs. But her T3, which normal is greater than 3.5, her free T3, it was 2, right? And it's been 2 for multiple years. This is somebody who sells hair, right? She's a hairdresser. She's getting to the point where she has so little hair remaining. She doesn't have anywhere to stick the extensions, right? It's literally like coming out in clumps. She said it doesn't even feel like hair anymore. And she feels like a fraud because how do you sell, what she's doing? And she's like,
Right.
I know it's my thyroid, right? Like I tell people She's like, I eat clean. She doesn't do anything processed. She doesn't eat gluten. She has minimal dairy. I'm trying to remember if they even checked thyroid antibodies. So, the cool thing about this is you can have a full thyroid checked. You can even go in sometimes do your own lab orders and get a TSH, a free T3, a free T4, reverse T3, and a thyroid antibody. And then you can have a real idea of what's going on. So that the cool thing about this was she came in, she's been frustrated. She's a single mom. She has two youngsters, two girls. And she didn't want to invest, right? She was like, it's expensive to see functional medicine. I don't know, is it really going to make the difference? But it got to the point where she was like, I'm going to lose business, right? Like I have so little hair.
Yeah,
I'm
but
going to
that's
lose
her
business.
identity. That's her, how
it.
you have to kind of like look the part, right? And so I completely understand where she's coming from on that. And how high was her TSH? Like, even though you said that the T3 was low, but but the TSH, was it like 4 or 5 and they say it was okay, or
It was 4.1
okay, yeah.
and they said it was fine.
And for me, it's pretty much optimal 1 and 2. It's
Same.
usually kind of like my goal. So I thought you were the same. Yeah, correct. So that kind of tells you right there that there's something else going on. And is she having any other symptoms? I mean, we can kind of talk over with our audience what kind of symptoms low thyroid can give you, because sometimes you want to know if this is actually truly like a thyroid issue, hormonal issue, or could it be something else? I mean, how old she is? She's in her...
She is
40?
32 something.
Okay. So yeah, quite young to start thinking about, perimenopause, but we've seen it all. I've seen it in their 20s on some cases, depending on what was going on or what took them to that state. But yeah, being of 30 is not quite normal. And I even have seen even many patients saying that, oh, it's just maybe aging, or maybe it's just part of it because, living a busier lifestyle or busy with the kiddos, etc. So we're kind of like going over the typical low thyroid symptoms. Clearly she had number one issue, right? The hair loss. And then for our audience, other common features that we see in patients is, of course, they have complaint of fatigue. They can have the weight gain because that participates in our metabolism. Obviously, when you have too much thyroid, the opposite can happen. People can be more losing appetite, being kind of more skinny, losing weight. But then when you have thyroid is not doing great, then you can start complaining about gaining weight. And then, of course, it does affect your mental health. I mean, there are studies linking with low T3 in the brain contributing to depression. And actually, when we look into T3 replacement, it is considered off-label for depression when you actually would prescribe T3. So that is actually important. So I don't know if she's having also some kind of like your common issues related to, mental health concerns, or even a brain fog as well. Your brain, your memory, your recall, your brain power, it's not the same either when your thyroids are...
Yeah, and she pretty much is about as cookie cutter as you could be. Increased weight gain, she's always been the same. Every time she had her baby, bounced right back to the 130. She's 5'8", 5'9", put on 10 pounds, can't get it off no matter how much she diets, exercises, whatever. Like you already insinuated, but definitely in perimenopause. It's longer between her cycles.
Okay.
Up to 39 days when she used to be 28 on the dot. Even when she had, other exposures and everything, she was always very light, no cramps. Now she has cramps for 2 weeks. She has increased bloat. She said she'll drink a sip of water and she'll bloat, even though she eats very clean, not able to get the weight off. Like you said, fatigue. Also, like everything else, well, let's put her on an SSRI because that'll work. They started her on sertraline and just kept bumping up. Not working.
Didn't do anything at all. Yeah, not surprised.
Nothing. Yeah. So she actually said, she's like, with getting this, T3 on board, can I start weaning from my sertraline? And obviously it's getting towards, Dr. Gabby lives in sunnier weather than I do, but it's getting near springtime in Wisconsin. So I'm saying, yeah, let's start weaning off on that sertraline because it's not working, and you're not going to need it once we get your thyroid, probably it's either neuroinflammation or your thyroid. So
Right.
absolutely, she's going to go down to half dose. So hopefully at the next follow-up. So I was able to, I don't think the doctor had checked thyroid antibodies. So we'll get those before her follow-up. Super important because she basically said, she's kind of an easy case, right? We start natural thyroid. And for those listeners who don't know much about thyroid or have been treated by their doctor and have never felt right with thyroid treatment. Many of you who are listening, you already know about natural thyroid. Typically, if you see a conventional doctor, when your thyroid gets so bad that they finally say, "Uncle, let's treat you," you have a couple different options. We have Tirnosint, which is T4. It's the most biologically available, and that's T4. It doesn't have gluten. It's gluten-free. It usually is not covered, because it's not generic. It's not, it's not the cheapest pay. We have Synthroid, which is the brand name of T4, and we have levothyroxine, which most people come to us if they've already been started or on levothyroxine.
Right, right. And it's what's mostly covered by insurance, which sometimes it drives me nuts when I'm getting patients. They've been on several years with the combination of like even T3 and T4, right? And they're like, please change your patient to the levothyroxine because it's what insurance wants, it's what insurance would be able to pay for. And then I'm like, oh my gosh, I mean, how do I break this news to my patient? Of course, the majority always opt to like, I would just pay out of pocket and continue paying just because they struggle a lot. I was actually one of them. I remember when I first was diagnosed with low thyroid hormone, I was placed on levothyroxine. This was like about pretty much like over 7 years, 8 years now. And what was interesting is that, my labs were like, okay, the usual stuff, right? Oh, your labs are good. The levothyroxine is working, but I'm like, I don't feel fine. Like and it didn't feel great. But again, back then they were just focusing on the TSH and T4. So yes, on paper it looked fine, but I feel like crap, honestly. So I went to an amazing local integrative doctor who is a good friend of ours, Ashley Maltz. And I'm like, I need help here. And she actually, no, you need T3 and T4 because I was just barely starting on my whole journey and doing my fellowship and everything integrative. That's also how we connected. But it was like night and day difference. And I feel like it's that T3. And I've been doing, as long as I've been doing this and seeing some patients, obviously we have other factors, like there's genetics, right? There's people that cannot convert into that T4 to T3, which I recall I have one copy of that particular marker when I did my medical genomics. And then, of course, something that we see often, we have people struggling with inflammation or with toxins like mold. And that is the main driver, or having very awful gut issues, gut microbiome issues that a lot of my patients, when we discover what it might be the driver for that, and we actually improve that, I could even see better numbers on their thyroid. And many of them, I don't need to like adjust too much or increase their medication, whichever pharmaceutical they might be in with. So that's actually very important to find out, like, okay, why the T3 and the thyroid is not, is much more lower than it's supposed to. So we want to kind of find out about that. I don't know if you notice, most of our patients that have struggled with like mold, since we commonly see these kind of cases, that I would say across the board on all of them, I tend to see low normal T.
Yeah, for sure. I always call Hashis the gateway autoimmune, and it's always a result of mold exposure. You get the thyroid antibodies, you start getting all the weird symptoms, and and as I said to the patient, I'm like, we can treat this and bring you back towards normal, so you feel good, so you can walk this journey. Now, if you want to get to root cause, we got to go a little bit deeper, but at least you won't be losing any more hair because it's going to take a minute for all those hair follicles to respond and to start growing back.
Exactly. Yeah. And that's kind of like my same similar approach. Like we might kind of like optimize you while we try to figure out the rest or what is actually driving or causing for this. And then of course there's the other piece, the reverse T3, which a lot of our maybe our some of our listeners are don't know about, or they're not even aware that you can actually request this in your lab, or even when you're seeing your primary care doctor or whoever that you request thyroid, they can add it and check on that for you, which of course, a lot of my patients with chronic inflammation issues or mold, their reverse T3 is, high when it's not supposed to. So that is very like a good indication that there's something else going on.
And it's, it's so fulfilling, these people that have thought that, their heavy periods out of nowhere just kind of showed up out of nowhere, or the 10 pounds. Like, this person was by no means overweight, but she's been 130 her whole life. So adding that extra 10 pounds, like, that's significant. And knowing that she's doing everything right and it's not moving the needle like it always has in the past. And yes, when we jumped in and we talked about mold exposure, she's had a ton of it. So it's not shocking. Do we need to do it right away? Well, as I said to her, let's see. Let's see how you feel. And let's see if you want to get to root cause so that you can hopefully eventually get off these thyroid meds, because Hashimoto's is reversible, unless you ask an endocrinologist, and they will say that it is not.
Yeah. I mean, we've been doing this for a good while, and I would have to say it's amazing on how many people have these positive antibodies for autoimmune conditions. And there's something that is actually triggering. There's something that your body is sensing that is under attack. And that's why your antibodies are being produced. And then, of course, there is genetics predisposition. Of course, if you have already the genetics for it, but then you add in the environmental factor, then that is more chance for a disease to manifest itself, or even manifest at a much more earlier age than we're supposed to. I mean, I don't want to like open up this other topic. This might be something to talk in a near future, like a future talk from us, but like look at all these, like even the cancer, especially colorectal cancer, like how we're having younger and younger population that are actually affected with this. And you kind of start thinking like has to do a lot with our environment, what we're eating currently. We are currently exposed with things related to like, pesticides and things that are in our food. And of course, too much gluten and sugar and all these bad things that we have kind of like access to. And it's kind of like something that is coming even from school, like even the school system. It's just that we were talking about that earlier with my husband, like what are kids getting fed these days? It's not like great. And God knows what is in terms of chemicals. But then the same thing is also like, I was seeing somebody earlier talking about the hospital food. Like, it's just, there has to be a better way of improving or having, especially like not getting into politics, but for this to be addressed, right? Because I know that a lot of people kind of may criticize functional medicine approach to many things because they might feel like it's costly or anything. But in the end, yes, you might be paying a little bit to see somebody because they're not under, let's say, a health insurance, because insurance don't cover for longer visits for the doctor. But in the end, you might be actually saving yourself money when you kind of look at the bigger picture, especially when it comes to your health, because a lot of these patients, they just keep going. And you, like with that person that just started seeing you, I mean, if she wouldn't have seen you and she would have gone still with the usual conventional route, they would keep on giving her medication and she would just keep struggling. And then God knows, end up with having a mental health issue or breakdown and being hospitalized or going to the ER. I mean, many things could still happen. And then, yeah, that could even be more expensive for the health insurance, because now you have somebody that you could have prevented for them not to be admitted in the hospital. And now they're being admitted in the hospital because, they're just struggling and they're much sicker than they were, or full on Hashimoto, right? Like on your
Yeah.
patient case. So,
Yeah. Like that's the whole thing. You think about it, this person, in general, SSRIs, SNRIs, all of the medications don't work about 40% of the time. Well, probably
Right,
more than that. Why is that? Well, of course, it's because of the fact that it's not treating root cause, right? People don't have a deficit in serotonin or norepinephrine. They
right,
have something that's causing inflammation. They can't get out of the pattern. Oh,
right. And I kind of like for our listeners, Dr. Tami. So when it comes to like the labs, the functional labs, you would say the TSH, of course, right? Your T3, free T4, the reverse T3, and then your thyroid antibodies. At least get those basic stuff if we really want to take a good look at your thyroid and how things are functioning.
yeah.
I don't think I
And now
missed
the
any
heart.
other.
No, you got it. The hardest part is, like Dr. Gabby says, unfortunately, even if you get it ordered, some doctors won't treat you. They will say, I'm not going to treat you until your TSH is above 4. I'm not going to treat you until your TSH is above 5. I do it through how your body is doing, how you're feeling, how your basal metabolic rate is doing. I do basal temperatures once I start on T3 and T4 because I feel like that is the closest thing to at the cellular level where we see there is actually, we were talking in one of the functional communities about a test called a Thyroflex, which kind of checks at the reflex level how well we are keeping your thyroid to where it should be, where you kind of come in, you have this test and you adjust it based on that, because obviously even the lab numbers, they're
Mhm.
going to lag a little bit. It's not like we're going to
And
put
it
you on T3.
varies. Yeah, it varies day to day too. So,
Yeah. Yeah. So I always tell people, let's look at your basal metabolic temperature. If your temperature, if during COVID, right? I always take it back to COVID. 6 years ago, this time we were getting our temperature taken wherever we went. We go into a Costco or a Jewel, or a grocery store, all of the different things. You had your temperature taken. If you're running at 95 or 96, you have a thyroid problem. The basal metabolic rate that you should have a temperature of 97.8 in the morning before you start getting active. And it's lower than that, you're not getting enough active T3. So that's a better moment in time look. And that's something you can do at home. You don't need your primary to order. You don't need to run out to a lab. That'll give you a good snapshot of how your body is doing, because obviously even with blood work, takes a while for our body to get that T3 in and to start changing the way it's doing things.
right, right, exactly. I'm kind of interested about that. You said the Thyroflex, Thyro.
Yeah, it's been around a while. It's
Would it
funny
be like a
because
device or, and it's just measuring
Mhm.
your, and that shouldn't even cost much, right?
I
In
don't know. I
terms
think
of,
somebody said it's $500 and it's some sort of monthly fee. It's like a $69 monthly fee to
okay,
use it.
okay, got it. I mean, it's
Yeah,
kind of like a nice, kind of like new or added gadget that just kind of help you with helping patients or diagnosing patients in the clinic, which that would be great just to get a better, more kind of clinical information, like you said,
exactly.
not just counting on the labs. And now also that we have the ability of getting all these wearable devices, we had a little bit of a chat on that when I was at the Microsoft event for the Women's International event that they did, and I was part of the panel where it was kind of interesting about like, you know, now we need to do more and more stuff, especially in the research and when it comes to these tests and devices, especially for like female population, because we are very unique. We go through puberty, we go through obviously hormonal changes during our pregnancy years, fertility, and then of course becoming perimenopausal, menopausal. Like we need to have better data more on these, even these kind of like devices, especially used for women in their different era, right? And their different time. And one of the things that I do like to check, at least on my patients, is for the when it comes to the thyroid as well, like you said, the temperature. If they have, a wearable device or like an Oura ring, for example, they're kind of easier to predict where, obviously their cycle, where they are, but also getting that information about their body temperature, like how is your body temperature currently? Okay, now we make some changes, and that kind of helps you guide a little bit more into how their actually thyroid is also doing. So I feel like this is, we're living in exciting times. So there's more to come. Maybe one day we'll have something that would actually predict you're having no thyroid and we don't need to even do a blood draw for it, or, or make it kind of like easier for us to detect these kind of things and help on patients.
It's amazing. And it is really, I always tell people that this journey is exhausting. And like Dr. Gabby says, we're not covered, but is it worth it? Absolutely. And sometimes I shouldn't even say that. Sometimes we are on the back end. Sometimes you could submit and it counts towards out of network or whatever. But what I will tell you, and I'm sure Gabby would say this about, seeing her colleagues or me on my journey, I would do it all over again, because if I was going to stay feeling that horrible, I wouldn't care that going to see my conventional doctor was covered and that I had to pay out of pocket in order to get real.
Right, right, exactly. And I feel like I do hope that, maybe one day, health insurance will look into this as more of the quality of care, right? And especially with prevention, because we do quite a bit of work and digging when it comes to seeing these kind of patients that unfortunately they've been suffering with, like, being medical gaslit or, being dismissed. And unfortunately, we tend to see this more in the female population compared to the male population, because we're often kind of labeled as, well, maybe it's stress, maybe it's just that you're having a lot of anxiety, or because you're not sleeping well, and they can be a bit more dismissive when it comes to the symptoms, and they don't want to like look into further, like, well, you know what? I'm not sure about the T3 situation, but let's take a look at it. Or let's take a look at, your reverse T3. I'm also happy to have there's a local endocrinologist that she's more integrated and functional. So I've had some of my patients consult with her. So that's awesome, because she does look at those things and she does pay attention to even those numbers. And it's very validating, because there has been some cases that I'm like, well, the patient still, they are not 100% sure. They would still want to consult with an endocrinologist. And I send to her particularly, right? Because they want somebody that would spend more time with them and not just your 10-minute visit. And she actually validates the stuff that we've been doing and working. And she's like, oh, this is great. You're in the right track. And she might even give a little new insight about something else I didn't think about. So yeah, so it's actually very good when you have more support on that, especially coming from the specialist. But it is harder at times, at least in my kind of world, working as a primary care physician as well, of like patients kind of like the doctor, the specialist that I saw, they dismissed or ignored those labs that you did. But I'm anyways kind of go with what you're saying to me, because it's making sense and I'm feeling better. So I'm just saying that once a year just to fit the bill, right? That I'm visiting and doing my checkup once a year. But they obviously see me more frequent, or even see me, in a more even monthly if needed.
Amazing.
Yeah.
So the cool thing about this is it's pretty easy to get the answers if your doctor is gaslighting you or saying, yeah, just go on birth control, which is what this lovely human's doctor told her. Just go on birth control, right? That'll make everything. She's like, no, I got my IUD out because I thought that might be contributing. I'm not going to go on the birth control pill, which would have made this worse, right? Because
Right.
taking in something that is not bioidentical is going to make all this stuff worse. So I'm glad she reached out. She actually talked to one of her clients who has seen me forever, and she was like, okay, you know what? This is my year to take care of myself. The money is worth it. And you can't put a price on comfort, especially in your body. And when you're not feeling comfortable in your body, you got to keep looking for answers.
Right, right. I do agree. Well, I'm glad that she's anyways keep digging and looking for answers. And I mean, for our viewers, of course, we're giving you these recommendations. But of course, if you feel like you're trying to get your, your voice heard, in the sense of like, hey, I want to do these labs, and then the physician may be like do a little bit more digging. I mean, I feel like we know our bodies the best, and there are other people out there that might actually, like this patient that found you, right? That they might actually can get to the bottom of it, and actually you can start your healing and start feeling better. So, kind of like to recap, so you guys know, definitely these are the main markers that we would for sure do and check. There is again many different layers in terms of like, okay, is it a true problem, meaning that the thyroid gland hasn't been enough producing? Because again, there is a production problem. There could be also a conversion problem, which meaning the T4 to T3. And then obviously there is the genetic factors, or even the important piece that we may want to discuss is what potential nutrients we would recommend our patients, our audience, for example, in terms of things to kind of help fuel and that would help to get better, just part of your thyroid health, right? Usually we do know selenium is pretty good, and we do know that we need that. I don't know if you recommend your patients on focusing also on their nutrition portion just to optimize their thyroid.
Totally. So I always say iodine, especially with any kind of nodules. I used to test all of my thyroid for provocation, being a dose of iodine and then collecting urine for 24 hours. It's a pain in the ass, the test. With Hashis, there are certain Hashi influencers that say you can't give iodine. What I will tell you is I've had thousands of patients on iodine. You just go slowly and make sure
So the
detox pathways
amount,
are.
yeah, the amount is what is key, right? Or
Yeah.
like a smaller
Yeah.
amount. Yes, that's right.
Correct. You just don't throw them into a thyroid storm, right? Because it can trigger. But iodine, like Dr. Gabby said, selenium, zinc, super important for our thyroid health. If you're missing any of these, like Dr. Gabby said, or you're missing the enzyme, you're not going to make that active T. So your body is just going to either have T4 and plenty of it. So like if you saw your conventional endocrinologist or your primary and they gave you levothyroxine, if you're missing any of the parts of that story, you're going to have a great T4 number, but a super high reverse T3, like Dr. Gabby said, you're not
Right.
converting.
Exactly. And I feel like sometimes we are missing that, or patients, they go up on their levothyroxine, and then what ends up happening is that they start getting more irritable, or they start even having more like anxiety, restlessness, insomnia. I mean, all the things that would kind of like hint to be higher thyroid, but it's because they're not converting into that active form that they need, or better numbers on their T.
Exactly.
Eh.
So if your doctor's not going to walk this journey with you, find somebody who will. There are plenty of people that are knowledgeable about this and can help you. It's the first start, like Dr. Gabby said, when she first jumped onto this and she was tired and she had a munchkin and a new fellowship to do. Ashley said, yeah, let's do your thyroid because that's an
Yeah.
easy one.
Yeah. And that was actually, I'm very happy about that. Now, fast forward when I dealt with my own mole journey, of course, I was like, my T3 was always low normal. And it was the mole driving it. So once I got all the detox, I didn't even have to go up on I'm actually on the armor thyroid, which now I got the notification from the insurance that starting April 1st, we're not covering your armor, so it's gonna be out of pocket. And I'm like, okay, great. Thank you. I'll pay out of pocket anyways. But I didn't never had to go up on the dose once I did continue on with my detox and we took care of everything. Like I was consistently between 2.5, 2.8. Now my numbers are like 3 to 3.5. Perfect. So I didn't have to worry much about it or even increase. I mean, I had checked my zinc, so I was a bit more, I tend to run low on zinc and deficient. So that also may play a part. And those are, of course, ones of the things that help support the conversion to T3, right? The selenium, the zinc. Like you want to actually kind of take a broader view and take a look into that. And personally, I don't know if you actually tell your patients to get into supplementations with this, but for me, it's easier to just tell them like, hey, eat, a handful a week of Brazil nuts, and that can actually give you the amount of selenium that your body might need. And then, of course, when you're doing labs, it might be a good idea if they can check zinc and copper, which I anyways do automatically on most of my patients anyways, but because I want to get also a better view of how their nutrition is doing. And then we go into like their diet, right? What are they eating and how their gut is actually doing, and continue on with that and trying to figuring out what's going on.
Yeah, exactly.
So
It's good
now
stuff.
it is. So you're still in this journey with your patient then, since you just starting. Okay. Well, keep us updated. I hope she keeps doing well and thriving now that you're kind of like putting the pieces together for her. But it's kind of like an interesting case, and I've pretty much have seen similar cases like that, or cases where they were even their lack of sleep or their metabolism, right? And it was all due to a load where in years they were always told that your TSH is fine, like you don't have any concern with hypothyroidism, when it's not the case, clearly.
Exactly. And strangely enough, even though T3 is activating, right? Some people have insomnia. So
Yeah,
you get the T3 stabilized and they start sleeping through the night like a baby.
exactly.
Never in a million years, you don't see that in a textbook, but the more you treat thyroid, the more you become a thyroid expert. You see it all the time.
Exactly. And I mean, we've been doing this for a bit that you kind of have like a sense for it. But of course, because we have to be obviously listening well to our patient's story, be good clinicians, and, play a bit of that medical detective. And then, of course, we're using our labs to help support our diagnosis and our clinical suspicion. So I feel like that's, to me, that's key. I don't usually I'm not treating labs, I'm treating a person.
There you
So
go.
I take that to me is valuable. And I do listen to my patients. And I do have one patient though that I kid you not, her TSH might go up like by a point or 0.5. And it's like she flips into like a complete different person. She's like, my constipation is back. I am having trouble sleeping. I am feeling bloated. And when I look at the markers, I was like, wow. I mean, it was just by a point, and I optimize her, and then things kind of like get better. But I do have to say that on some of my patients, especially on my female patients, that I know we're mentioning more like female patients just because these are the ones that unfortunately have the more higher incidence cases of autoimmune conditions and even having hormonal issues. I would have to say that when I tend to see that they're going into like perimenopause, even their demands on thyroid, I see kind of like a shift or change. So sometimes I might have to I might have to stabilize this person because they're in perimenopause right now. I might have to address their cortisol. I might have to address some progesterone, and then they kind of get stable. In their mind, they were thinking that it could be the thyroid, but the thyroid kind of corrects itself because the other hormones are back on balance and being optimized. So I'm like, and they're like, I thought we actually needed to increase my dose. And I'm like, no, it's just that you're going through a different phase in your life. This is a new phase because you never had this before, which is becoming perimenopause and your hormones are fluctuating. We just needed to address this before, of course, we would go back and just bump your thyroid levels or your thyroid medication.
Exactly. And so much affects it, just like all hormones. So if you ever have any question, obviously, at least when you're getting started, make sure you see a functional doctor to help you see through this and get to what's going on and help you walk this journey, because it is a lot to take in.
Yeah, it's a lot, but I would say like, yeah, your doctors that have had some knowledge with functional medicine or red medicine, they would definitely clearly help. But as long as you have somebody that is not rushing and is willing to work with you or listen to your story, I feel like that's enough, and that can be very helpful. Or at least like, hey, I don't know much about it, but hey, I know a Dr. Tami in town that she's been doing some work on this. Let me refer you to her and see, take a look at things. Even if you're not aware, you don't know much about it, but at least if you're curious, I feel like that's much needed, especially for some of these patients. then unfortunately been like running around between too many different doctors. And sometimes when they see you or they see somebody like me that's doing this kind of work, then they're kind of frustrated, or they're like already like so upset that you're like, okay, this is going to take time, but if you can work with me, we'll get you better. So it's just takes a little bit more patience and time.
Sure does. So thank you guys for joining us for it's probably one of the topics I hear most about. Gaslight, my thyroid, nobody's listening. So that's why Dr. Gabby and I decided this would be a great jumping off point for our talk tonight.
And if anyone else has any other suggestions or anything that they would want to listen to, you can send us a message, or if there's any requests. I know I may have also some other interesting cases that I might bring up in a future episode as well. And pretty much just kind of like letting you guys know how we pretty much work with our patients and the kind of work that we do, and trying to kind of dig deeper and trying to find the root cause. So I hope this was helpful for everyone.
Thanks for joining us, guys. Have a beautiful night, and we'll look forward to talking more about something cool in 2 weeks in our consult room.
Yes. See you then.
Bye, guys.
Ciao.
Thanks for spending time with us in the consult room. If this episode gave you a new perspective on thyroid health, share it with someone who might need it too. Take care of yourself, listen to your body, and we'll see you in the next episode.